Today, we are announcing criminal charges against 19 defendants for fraudulent home health care schemes that targeted Pennsylvania's Medicaid fraud program and resulted in over $4 million of fraud. 18 of these defendants were charged in the last 12 days as part of a strategically coordinated law enforcement operation between the Fraud Division, the U.S. Attorney's Office, and the Pennsylvania Attorney General's Office. They are not paperwork errors or good faith accounting errors. They involve supposed home health aides who billed the taxpayer for home care services but never actually provided those services, and supposed Medicaid patients who conspired with other fraudsters to bill the taxpayer for completely unnecessary health services. We are announcing today that our Northeast Healthcare Strike Force team is expanding here to Philadelphia. This will place dedicated fraud prosecutors right here to further root out the fraud in Pennsylvania. This district has a long-standing tradition of not only prosecuting egregious frauds like the ones charged today, but also a history of excellent corporate enforcement, both civilly and criminally. In fact, today the U.S. Attorney's Office is announcing charges against not only individuals, but a company, a home health agency that participated in the fraud.
Now, we're facing a personal care services crisis around the country. The surge in enrollment of individuals in these programs is stunning. So shocking, we have to double check our numbers. We don't think it's possible that it's happening, but it is. In California and New York, the #1 job in the entire state is personal care services. Guess what? It's good to be home, because it's true in Pennsylvania too. 50%, dramatically more people serving in the personal care services space, that's home care, than is in retail. What we're exposing today is a diabolical breach of trust, a violation of the sacred bond between patient and caregiver. It is a catastrophe that can only be dealt with in the way we'll be outlining for the rest of this presentation. So the biggest allies in cleaning up fraud are the legitimate providers. Kim Brandt mentioned bond between patient and caregiver. It is a catastrophe that can only be dealt with in the way we'll be outlining for the rest of this presentation. So the biggest allies in cleaning up fraud are the legitimate providers. Kim Brandt mentioned